Hey Christina, so a lot of times when you get that tension that you feel in the hips, it'd be adaptive tightening that happens over long hours. Uh, just tends to mean that an area of that quadrant of the hip is getting irritated, and it's typically from an imbalance, strength, regarding something's not doing its job fully or something is overactive, and then the other part that like supplements it is underactive. We've talked about this in the past about how things are kind of translational in terms of where they're pulling from and where you might feel them. So, what I would do is maybe you could start your day or right before you really get down for a long session. Start with like a good 4 to 6 minute, hip series, and I'll go through a few movements here with you, just something you can take up from. And you could always keep some of the movements shorter, and you can extend out and lengthen out some of them. But what we do know is that if you can get some tension gradually applied to the muscle and then release it, and then apply that tension relaxation phase with just continuous load, right? Like so, internal loading, then we'll get some extra blood flow into that area. That should help out a lot with what that kind of feedback system in the muscle will send to the brain, right? And that's where you're feeling that tension is. Just it's kind of a lack of circulation. It's a lack of appropriate release of the tension, right? So if we can get some activity going in there, warm it up, get some fresh blood flow, that typically will help out quite a bit, at least preparing you for a long series. And then you could do something very similar or even just do some static stretches after a long series of sitting, in which you can at least address some more specific areas. So a couple of things that I really like to do, if I got, you know, 6 minutes maybe, I might just run through a series, but I'll take a sit on the ground or I'll dig the heels in. I'll try to split out the knees. And I'll try to maintain my posture upright as I go through, but I'm going to rotate both knees as close as I can to the ground. Now, it's not so important that you touch both knees, but that we just kind of shift the weight from one glute to the other, and we get both thighs to kind of rotate internally and externally. And I can let you use your hands behind your hips to just provide a little support and work through that range of motion. You could also integrate the core a little bit and you can clear the hands. And maybe about 8 to 10 on each side. Doesn't need to be a big hold. It's more about how your translation goes into that next movement. And depending on how tight you're feeling, you may hold a little bit longer too. So feel free to interpret that, open that out a little bit more when you need to, okay? Another one I like to do is for really kind of hamstring issues, okay? So if like you try to do a bend over and like it's barely past your knees, it's a good sign that we need to loosen up and start to elongate the ability for those hamstrings. And so one gradual progression you can do is stand nice and tall, bring your feet in pretty close together, okay? Keep the back straight. So think about what a deadlift is. We're going to push those hips back. We're going to slide the hands down. Now notice the back is trying to stay as straight as possible. And just start to go down until you start to feel some initial resistance in those hamstrings, okay? And early on, it may not take that much. We're going to get you to extend back up. And I even like to try to do it a little overhead reach and kind of anchor the hips by squeezing the glutes as I extend. What that does is it allows me to get a little stretch reflex on the hamstring and glute before I start back again. And as I go into it, I can get a little deeper and back up. So as long as you get that deep hinge, you can keep those knees back, right? And just gradually apply a little bit more load. You'll start to feel those hamstrings open up a little bit. And that'll start to open up some of this posterior chain anchoring, okay? All right, so from there, what I might do is kind of what I would call like a downhill ski squat. So bring my feet in pretty close. Try to keep my entire bottom of the foot flat on the ground. And I'm going to just try to change the level. So I'm going to let the knees go forward. I'm going to send the hips back and maintain my posture. And I'm going to just see how far I can kind of anchor myself down. Not letting my knees kiss each other. Also not trying to let my hips shift out to the side. So simply trying to stay in your tube and compact yourself. And you're going to feel a good stretch through the ankles, into the hamstrings and the hips, right? And as long as you can maintain the posture and you can keep yourself compact, you're going to feel the whole chain from hips to ankles really start to apply some of that Again, that resistance, that tension, and that takes away that inflammation feel, that tightness feel. So sometimes it's not even about something's tight. It's a very similar sensation to something that's overactive. And so what we're going to do is just make sure we get some attention to that posterior chain as well. All right, so you can do more of those. You can hold the bottom longer. That really helps out if you have calf issues, anything running up through the hips as well. Okay, favorite of mine is to do a pigeon stretch. So I could start on my butt, put that knee in front, and then let that leg cross, and then just very slowly start to work myself in front, right? And also try to push that knee back. And I don't even need to go to the ground, okay? All I'm trying to do is get this knee behind this heel and this knee in front of this hip, right? And I can just leverage myself into that position. And as soon as you feel that glute really getting a good stretch, hey, that's good enough, all right? If that resistance is there, just stick it out and give it a good 20 seconds, 30-second hold, and breathing really helps. So if you can breathe and get some oxygen into that blood and that muscle, you'll start to release some of that tension that you feel. If you're feeling tension in your lower back, that's a really good stretch to do as well. Take your time, go on the other side. Block that heel. Gradually work that other knee back. Remember, we don't have to go down low to the ground for this. We're not all yogis. It doesn't always work that way. Go with what you feel in the hips and the glutes, and just apply some gradual tension. Again, focusing on breath. It's not necessarily about hitting landmarks with what your movement shape is. That's not always the goal. Sometimes it's just strictly, what are you feeling? What is your muscle or your joint telling you? Where you're getting resistance. What just needs to be a little bit of time and care. And then consistency will definitely pay big dividends in terms of how you feel, but also what you're seeing the movement transpose into, okay? So that pigeon stretch is a good one. Another one I really like is like a single leg frog. So I'll post one leg out to the side. I got this knee kind of outside the hip, just barely, right? I'm going to sit back a little bit, so I'm kind of creating a tighter flex in the front of the hips. And then I'm going to lengthen out that adductor. So that inner adductor, it's largely responsible for pulling those hips into a anterior tilt, all right? And we know about the anterior tilt, right? Pulling on the hip flexors, but also kind of arching the lower back quite a bit. Shuts off those hamstrings. So by lengthening this out and not allowing that knee to go into that valgus movement, right? You can really get into a good stretch. This one is alternative, like you can choose to do that single leg frog. One very similar to that, and what I find a lot of people really like is taking a wide stance, and we'll just kind of do like a lateral lunge, almost slide, where I'm pushing that knee out and just keeping the other leg straight. And it's just that kind of pull push relay that you really get that sensation of seeing those adductors pull along, and you can understand what you're feeling in the front quadrant of the hip flexor here, okay? So this is one of those fan favorites where you just, again, go very slowly. If you want to use a chair or a table to kind of help keep your posture in position, that's exactly what you want to do. So simply put, all I'm trying to do is apply some type of loading mechanism into those bigger muscle groups, or even smaller muscle groups that work the hip stability, work the hip mobility, right? And think about the functions of what the hip does, okay? So you've got flexion and extension, right? So if the walking or running or jumping, right? Sitting, okay? It's where that knee is going in front of the hip and then the foot travels behind. So flexion, extension, okay? You have abduction where the thigh will flare out, and then you have adduction where it's going to cross over. So depending on what we're doing, often that adduction can become over dominant and we don't do enough of the abduction. Okay, so you can certainly do like leg swings, or again, that pigeon stretch really stretches the abductor. The lateral lunge I just showed you, that's a good one to kind of engage those stabilizers on the side muscles, okay? And then you have rotation, all right? So basically, if I wanted to rotate my ankle either way. Again, it's kind of another benefit of doing like a frog stretch, or even if you wanted to do some band work where you can hook it around the foot and just kind of work on turning the ankle in and out, right? That's one way. But pigeon stretch has that leg going into an internal rotation. So if you can take care of those basic functions of the joint, then a lot of that supporting muscle group, area should start to feel relief. It's actually how you take care of, things in the lower back, because it's all connected, of course, okay? So just give you a few examples, but think about the premise of the basic movements of the hip, and then what are some movements that you could do. Obviously, some of it depends on how you're dressed for the moment. You could always go back to old standing leg circles, hip circles, leg swings, right? You could do some of those gentle lunge movements. And then if you got gym wear on, you can pretty much get as creative as you'd like. But hopefully that helps out a little bit. Remember, movement gets blood flow, helps reduce some of that inflammation that you're feeling, which is possibly that tightness. But we can also get that posterior chain activation. And it's consistency, okay? That'll help you out a lot. And after maybe a couple days and maybe one good stretch, you'll feel a lot of relief. All right, let me know if you have other questions, and I'll see you soon.